Silver lining in pediatric cataract surgery. Light but becomes easily visible under the oblique illumination of an endo light. Note how the margins of the nick made in the PC are clearly made out using the endo light. And as viscoelastic is being injected, the anterior vitreous phase is seen being pushed away from the PC and the two margins are clearly seen. Posterior capsulotomy can also be done using a rhexis forceps. The posterior capsular flap, which is hardly seen under microscope light, can be easily made out using an endo light, making a continuous posterior capsular rhexis an easy task. A well-centered round PPC is seen in the end. Posterior capsulotomy can also be done using a vitrector. Note how the flimsy capsule is being eaten away by the vitrector port. A well-centered round PPC is seen in the end. Some surgeons prefer to implant the PCIOL first and then do a PPC. Note how the PC opening under the PCIOL is well made out using an endo light. Endo light is an extremely useful tool in achieving a complete anterior vitrectomy. Note how the vitreous strands are being pulled into the vitrector port as they are being cut. After an anterior vitrectomy that almost appears complete, sweeping across the pupil with the iris repositor and viewing through endo light shows the presence of vitreous strands. Hence, endo illuminator is a very useful tool in confirming a complete anterior vitrectomy. A well-centered and round PPC is seen in the end. In this case of mature cataract, the visibility of the anterior capsular flap reduces as the liquefied cortex oozes out, but becomes clearly visible once an endo light is brought in. It also helps in enlarging the anterior capsular opening when the rhexis made initially is small. Endo light is indeed a very useful tool in performing cataract surgery in eyes with corneal opacity. In this case of bilaterally subluxated lens, note how the anterior capsular opening is being made. In the other eye, the capsule is now seen being pulled away from the posterior corneal surface. In this case, with thick visual axis opacification, endo light is being used to differentiate the anterior and the posterior membrane . And a clear visual axis is obtained at the end. Here, the endo light is being used to visualize a pre-existing anterior capsular opening. It also helps in peeling away the fibrin from the capsular surface. Endo light is a very useful tool which helps in confirming the position of an IOL. With the help of endo light, the anterior capsule is seen overlying the PCIOL. And here is a case where an optic capture was done. The anterior and posterior capsular edges are well made out using an endo light. In our study published in Eye, We demonstrated how endo eliminator can be used in pediatric cataract surgery and reduce complications due to inadequate vitrectomy. Hence, endo light can prove to be a powerful tool to achieve good surgical outcomes, especially in the hands of a novice surgeon.
Sumitha,
Silver line.
I have two questions. One is why it is called endolight, and why your visualization, why you think it is better than microscopic light?
So, why it is called endolitis? It uses the same principle as the luminance. Basically, it's a tube in which
it's only fiber optic light. It's not
fiber
endolight.
optic. Yes, sir.
Once you keep inside the eye only, you can call endolight.
Correct.
You cannot call it as endolight. It gives a wrong impression that you
this is
are
an
putting the
external
light
use.
inside the eye and doing surgery.
Correct.
So it cannot be called endolight. Technically, you have to call a fiber optic
external.
light.
Correct.
So number one. Number two, why you think it's better than microscopic light?
So, because microscopic light is a illumination from above, sir. It does not give an oblique illumination. You cannot give an oblique through
It's a more coaxial, and here
Yes.
you got a more oblique.
oblique.
No, you can always put the coaxial off, and then it becomes a
So
without
It does enhance.
a red
Putting the
reflex.
coaxial
Yeah,
off does enhance. I agree with
Yeah,
that.
6 degrees. Now here is you are having 20 degrees, 20
Yes.
or 30 degrees.
Yes.
That gives more oblique light, gives more, like
More,
a shine plug, it gives a better. And another thing is the illumination. Illumination
sir.
is very near, so it's much brighter,
Yes.
and you can shift it. Only problem is you need a third hand. Somebody
Yes.
has to.
So you need a good assistant who is aware of how to hold the external light. That's right.
I think the other advantage is that you can swivel it around
Yeah,
in
Yes.
various
wherever you
axes,
Yes.
unlike a fixed slit illumination, where you can only do it in certain axes, but not in all.
Yes, sir.
But the fact that it is a very, very strong illumination, and it is also a spot, but it's oblique, gives this benefit.
Yes, sir.
20 degrees, 30.
But as far as the technique is concerned, this has been described
For a long
for quite a long time,
Yes, sir,
at
that's
least
right.
10 years. But you put in a very nice compendium of multiple situations where you've used it.
Yes.
It's a very nice video.
Yes,
Thank
sir.
you.
Thank you, sir. We've been consistently using to train the pediatric ophthalmology fellows, and we're also doing an ongoing study where we are comparing how easily they're doing with and without it.
Right.
We
It's
get to
actually
publish the
useful
results.
in not only in pediatric ophthalmology, but even in lamellar corneal transplants and so on.
opacities.
There's so many places where this can be used. So yeah, good.
Thank you, sir.
Next.